I will let you know when to unmute. So at least we can get on with the presentation. Okay. We'll have a lot of time talking about fall prevention, how to work your core, and of course, important solution that that we need to prevent the fall from happening. All right, I'm gonna click admit all. All right. So probably let's wait for one more minute. And then I just want if you can raise your hand or not if your camera is on, if you guys can see my presentation. Yep. Great.
Might have put a thumbs up.
Yep. Great. Thank you guys. So you probably won't see me, but I will kind of toggle, my screen once it is something, that is, worth showing in terms of the activity that we're going to do. I'm gonna go through the agenda for this night's presentation. So before we get started, thank you so much for joining. It's always a pleasure, having you guys come in, listen in, join us, as a community to ensure that whatever we're learning here is something that we're actually sharing with other people. So sometimes, like I said, it is a series of information. Like I said, this is like our third workshop series. And then as we grow, like I said, it's always important to understand, why it is arranged the way it's arranged. So since, to benefit the fall season, we're going to talk about fall prevention. So I always like to give it a title, Dare Not to Fall, Strengthen Your Core. So this presentation is brought to you by my company, For Life Healthcare. And by the way, for those who's new to this workshop, my name is Dr. LJ Brooks. And just a little bit of a background, I'm a physical therapist for 20 years. My specialty will be your pelvic health, your pelvic floor, lymphedema, osteoporosis for bone fit, and chronic pain. So anyway, I actually like this, this picture, right? Because when you type fall, most of the time for this season, this is the first thing that you're gonna see, the changing colors, of the season. And I know at this point you probably are walking a little bit slower because you can just, this is practically my favorite season of all seasons. So let's get started with the agenda. So for the agenda, of course, we're going to talk about false facts and prevention. So these are fast information about falls, how to work your core, your balance, beginner core exercises. And of course, as always, I always want to provide resources so that you can, on your own, go through it, check out what kind of use you would, do with it. And then again, it's always about sharing. Share it with, other people that you feel would need that information. Okay. So I'm always very mindful about your time. So just making sure that if I do go over, or if there are any information that we can actually talk outside of the group, you can definitely stay longer past the 7:30, 7:40 mark, and then we can talk, for as long as, of course, not until 9 o'clock. So things like that. So anyway, resources for fall prevention. I'm actually excited about that. And then false fast facts. So the moment that you start counting, according to CDC, every second one older adult actually falls. And that is one of those, things that it sounds scary, right? But at the end of the day, the more you know, the more you do better. So understanding that this is the statistics, and sometimes they're looking at, well, if this is such a big thing, why are we not preventing it? So that's the reason why you guys are here, because you care not only for yourself, but you also care for other people that has a very high chance of falling. So that's why the first part would be, you have to talk openly to any loved one, may it be a friend, may it be a church a goer, or if it's your mom, your dad, definitely it's always understanding like what are the risks. If you start noticing that they're walking differently, or probably there's a change in their physical ability, that they're sitting more because of pain, because of any, any reason, because they feel dizzy, because there are some reasons for, for falls wherein it can be both vestibular, meaning it includes your sense of balance, and non-vestibular. So those are like the major category of how we can identify what is causing the balance issue. You know how sometimes when you get up and you start feeling dizzy, you have to determine, is it your inner ear that has a problem? Is it your blood pressure may be low, or you haven't eaten, or your blood sugar just dropped. So there's so many reasons. So pinpointing what's the root cause of why you have balance issues will basically, in timely manner resolve the issue of your balance. So the other part would be, of course, to have to be honest and talk openly about your fall risks, knowing there's a way. The great thing about it is there is a way for you to kind of determine your risks, right? So knowing that, okay, if I scored this number, and that's what I do as a physical therapist, I give my patient, a number whenever I try to test their, their balance. So it's not like, you have good balance, you have bad balance. So remember, I always be mindful about, you cannot improve what you can't measure, right? So if we give a number like you are here at this point, this is your baseline, and for you to be able to say you have a good balance, this is the score that you're supposed to hit. Okay, so there are different aspects. We can talk about it even more, right? So the other part, the other aspect that I wanted to highlight right here is being able to see and walk comfortably can prevent falls. So we try to, let's not go too deeper. Let us try to understand that, oh, let me see. When was the last time I went to the eye doctor, right? When was the last time I even, checked whether my prescription, eyewear is actually still okay. Things like that, because sometimes that has a very big impact, right? So you see how it says see and walk comfortably. So the walking part is associated to, does it hurt when you walk? Do you feel balanced when you walk? So sometimes you say like I'm okay, like you don't notice anything, but then again, like some people would say, well, you're walking a little bit differently. So sometimes it's about how you feel and how you're actually been, managing that walking. And even as simple as the kind of shoes that you're wearing, right? One of the first session that I always talk about my patient would be, are you guys even, are you wearing the right kind of shoes? Are you wearing one of those slippers, or foam kind of, shoe wear? So just make sure, like, you're trying to minimize your fall risk by managing, those two little things, your eyesight and the kind of footwear that you use when you walk. So yeah, have your eyes checked by an eye doctor. And one of the things about falls fast facts, it's a tongue twister. Most falls happen at home, which is weird, right? Because you might say, wait a minute, whenever I'm at home, I'm supposed to feel safe around the house, right? I'm supposed to feel that, I know where everything is. I know where, my carpets are. I know where my chair are. But then again, if you're a little bit distracted and, like I said, there are things that's happening to you that you overlook, that can actually cause your fall. And then activities that can improve balance and strengthen your legs, like Tai Chi, can prevent your falls. So these are like I said, fast facts. But let's go ahead and dive a little bit deeper about the information on your fall prevention. Thank you so much, guys, for joining. All right, let's start this way. Okay, so the very first thing that we have to check is your risk, right? So this presentation, like I said, I always copy this on YouTube when I post it. So again, just a disclaimer for those who just joined in. This this presentation is recorded. So if you guys want to, remove yourself, basically remove your camera if you want to, or be on mute. So just FYI. Anyway, so the first thing you're going to talk about is let's check your risk. NCOA, that's the National Coalition of Aging, has a falls free checkup. So it's not like a checkup that you go to the doctor. It's actually a questionnaire. So when you go and I click this, do you guys see the checkup? So
No.
no, okay. Let me just, I think I know what's going on. Thank you for letting me know. So you just see the PowerPoint, correct?
Correct.
Yeah. All right. Let's see. Let me stop sharing. Share again. Go to screen. Share. There. So do you see the National Council on Aging
Yes.
part now? Okay, perfect. Thank you. Thanks, Stace. So this again is a free, like you just want to know, right? Knowing, what you are like where you're at, it will basically so who is providing, and this is not just for the patient. So if you go on the first part, it will actually tell you, do you want to just ask for your own information? Do you want to ask about for a friend? Is it about, if I'm a therapist, I would choose my patient's information or my client's information, whichever applies to you. Let's just say I want to just know about myself. I'm going to click my own information. And you see how it says these are like 13 questions that you can ask. So the first thing is, I have fallen in the past year. So I'm going to click yes. And then there's another question. I use or have been advised to use a cane or a walker and so on. And if the question sounds, unclear for you, there is a question mark right there. And it will clarify, why the question is relevant. Okay. So, like I said, these are part of your resources. This is something that I'm going to send as a link on the presentation. So, when you go to the presentation, as soon as I post it, you're going to have the information on all the links of what you're going to see here, right? I just can't go through all the questions today. But like I said, this is again a resource for you to know. And if I go, let's just say all the way down, right? It will even ask about your medication, about your sleep. So they're all interconnected. So it's not just about weakness, it's not just about pain. There are so many moving parts when it comes to balance and fall prevention. So even asking, have you lost some of your feeling in your feet? Do you often have to rush to the toilet? That's for pelvic health. Do you have trouble stepping up on a curb? So all of these questions, has all are all relevant. And then as soon as you get all the information, and again, you don't have to explain anything. It's just a yes or no question, right? And all of those information is required. And then once you answered all of it, then you can just click get results, and it will actually give you the information of what your risks are, right? So again, that's your falls free checkup. Okay, from NCOA. So I'm going to stop sharing this part, and then I'm going to go back to sharing the presentation. So that's this part, the falls free checkup. Now let's talk about static versus dynamic. So one of the things that we have to understand, that balance is not just when we're moving, it's actually tested even when you are just standing or even just sitting still. So whenever, because I've worked with patients from different, different conditions, from patient who's just getting out of surgery versus patient who's in an outpatient setting that can balance on a balance phone. So we have to be able to make adjustments on what kind of test we're testing. So the first thing we have to understand is what is the difference between static and dynamic, right? So when you talk about static, from the term itself, you're like a statue, therefore you're just staying still. So sometimes there is a question like, okay, well, that's my determination. If you cannot even stand still without holding on to anything, then again, it's going to, most of your exercises has to be focused on how am I going to improve your static balance. Then we can move on something much more challenging, like putting weights on your legs, putting weights on your arms, just to see how your balance looks like. Other thing about static is actually understanding that how's your sorry, how's your base of support, right? So if your base of support is too big, right? So obviously the bigger the base of support, the more balanced you are. So when we're testing your balance as a therapist, what we usually do is we ask you, can you put your feet together? Right? So probably you guys are familiar with that test, the narrow base of support test. When you put your feet together, and we ask you to hold that position with your eyes open for 30 seconds, if you're able to, so that is something, guys, you can do on your own. Just make sure you're in a safe and you feel like you're safe in doing that. So again, standing, narrow base of support, putting your feet together and with your eyes open. Obviously, your sense of balance has three major category. The first one is your sense of vision, right? So if you can see, because your vision, that is the one that sends signal to, to your brain what your surrounding looks like. That's why, remember, when you guys, let's just say when you're sitting right now and you're not leaning against, against your chair, and you start closing your eyes, you feel, pretty little bit unsteady. So because your vision is a very important part of your balance. So one thing that we usually ask our patient whenever they're performing a static balance test, so again, this is a test, is when you put your feet together, have your eyes open. Are you able to hold it for 30 seconds? And then if not, then obviously when we ask you to have your eyes closed, then we have to stop the test right there. It means we already have a problem, because the moment that we have your eyes closed, then you'll definitely lose your balance and not going to be able to do it, right? Because again, you need much more sensory input, such as your vision, to improve your balance. The other sensory input that is important for balance is actually, besides vision, is that feeling under your feet. And that is called proprioception, right? So a lot of times, especially if, we're suffering from any form of neuropathy, right? So we probably heard that from the doctor, may it be diabetic or non-diabetic, you probably would have neuropathy. Definitely that will automatically impact your balance, because again, you're supposed to feel the ground that you're standing on. If you can't feel it, then it's going to be a problem, because how are you going to feel whether you're even walking properly, right? So even with the static balance, if you feel like I don't really feel the floor as much, then that will impair, that you will have some balance impairment there. So you have vision, you have your proprioception, or the feeling under your feet. And then the third one will be your sense of balance in your inner ear, right? So that is the vestibular part. Okay, so there is a way we usually test that in the clinic. We try to take away as many inputs as we can. So usually the first thing that we do is we go ahead and make your eyes close, right? And then after we make your eyes close and you pass, guess what? We have to challenge you again. We have to put you on a balance phone, make your base of support smaller, right? So, and then that's when we can determine whether, oh, we took away the vision, we took away the proprioception under your feet. Therefore, you can pass all those and you can hold it for 30 seconds. That is amazing. So there's very less likely that you're going to lose your balance and fall because you passed those tests. Okay. So that is for your static. Dynamic is about you're starting to, to do your movements. That's why part of, the test that we do is the dynamic gait, which is involves you moving and walking. So it's always important to actually measure static first. And then if you pass your static, then we can transition to dynamic. Okay. All right. So if you have any questions, you feel like it's still a little bit confusing. So the whole, bottom line is as long as, you understand the difference between static and dynamic. And if you have any specific questions, write that down, and then we can definitely have a Q&A later at the end of this session. Okay. So we also have best test. That is your balance, evaluation specific test that basically records. Why do I keep going to your abs? Okay. That has three major factors. Actually, we try to work, separate for the dynamic gait because we do a dynamic gait index. We do anticipation for your balance. We also measure reaction balance and we also measure sensory orientation. So whenever we talk about, all these risks, it's not just, okay, let's go ahead and lift your legs up, right? So there's multiple ways of actually checking your balance. And sometimes by just knowing which part of your balance system you have issues with we can basically help you resolve the problem, right? So narrowing down where the problem is coming from.
LJ,
Yes.
when you say your balance system, what are you talking about? You're talking about the different
Yeah.
dynamics?
Different dynamics of your balance. Yep.
Okay.
So it's either are we measuring your anticipation? You're actually expecting that you're going to lose your balance. Reaction time is how fast do you react when you're about to lose your balance. Sensory orientation, this is the one that I was just talking about regarding it's your vision, when we remove your vision, you basically about to lose your balance, or if you can't feel the floor or you put you on a balance foam, you're going to lose your balance. Those certain things, depending on where your impairment is, as a therapist we will be able to to identify how we can help you or what form of exercises we can help you with. So that is, and that is actually a good way to kind of show you what the best test looks like. I'm going to stop sharing and then share again. All right. All right. So the mini balance evaluation system test. So this is the purpose really is evaluating your balance. And there's a long description of what that is. So this is not really, important to actually know. One of the key things is you just need to learn what is the purpose of this balance. So it is an evaluation of how your balance looks like. And like I said, it's divided into four categories. It's your anticipation, it's your reaction time, it's your sensory orientation, right? And then your dynamic gait or your movement. And then for your score, you see how, like I told you, we'll provide you a score. And the goal, as when you go through the process of doing your therapy, we want to make sure, like, if your score is between, any the lower the score, the poorer your balance would be. And then obviously the goal is for you to hit 28. Then let's do this. All right. So the reason why we're all here besides learning about falls is we need to learn how we're going to prevent it, right? Prevention is always better than cure. Let's not wait to fall until we do something about it.
Hot
So
voice
let's
Hot voice
learn.
tapping.
I'm sorry. Oh, okay. Let us learn more about your core.
Tapping.
one of the misconception about the core. We always thought core is just your abdominals, right? No, actually, core is if you wrap around your midsection, the front part is your abdominals. That is comprised by your transverse abdomen. So I don't want to confuse you guys with all the names. Just so you know that we have superficial muscles, like that forms our six pack. And then we have like transverse abdominis, which is the corset muscle that actually makes that's important during your belly breathing. And then all your obliques, that's also important with your, with your rotation. So that's also one thing that we have to look into. And then it says, where is your core? Core is your abdominals. So that's the front part. And then core is also formed by your back, your erector spinae. Those are like, how sometimes when you feel like, why does my, when you feel like my core is really, really weak, especially for, women um, that, postpartum or actually had a child, usually one of the issue that they have is they have low back pain. It's because their core is, weaker. And then obviously since the core is weak, which part of the body do you think is covering up for the weakness of your, of your abdominals? It's your back, which is again part of your core. So we have to, basically understand, like, it's not just the front part, it's the front and the back. Okay, so that's why we have to talk about what are the core exercises to, to improve your balance and your posture, right? So we have been talking about, osteoporosis, strength training of, of your bones, how to manage it, how to manage your posture. So it is very important that if there is a study that they did about core exercise, so every time you improve your core, it's directly proportional to improvement of both, not just your balance, but actually the improvement of your posture. So, like I said, we always have to start with the easiest thing that we can actually manage. And you already know the first one, and that is belly breathing. We also have to do exercises. This is actually the other way around. We have to start with sitting, standing, and then functional core exercises. Okay, so let us now navigate around the different core exercises we can do. Belly breathing, right? As actually one of the things that we practice for, your pelvic health. You might want to look, wait a minute, I have problems with my pelvic floor. Why do I have to talk about breathing? You know, the best way to actually manage your, your pelvic floor is learning how to coordinate, your breathing, because most of us actually just don't breathe properly, and that is because of how our position is. So we already talked about posture, positioning, how important that is, but try to focus on, am I really, really breathing properly? I know for some of my patients that I talk to, right? Wink, wink, Miss D. All right, that, whenever you're breathing, you have to really accentuate, your belly breathing, meaning your belly is getting bigger, right? You have to put all your air. That's why when you see inhale through your nose, fill the belly with air, not the chest. Okay, not the chest. You see how there's a thumbs up and a thumbs down, right? Upper chest breathing, you are using accessory muscle, therefore, you're not really breathing properly. That's what we call shallow breathers. And to tell you honestly, I usually see probably patients that are like in their 40s or even 30s, and some of them are shallow breathers. On day one, when we talk about their them learn how to do proper breathing. So this is basically our day one. So we do inhale, fill the belly with air, your chest and shoulders remain relaxed. Okay. So what I want you to do, if you're like, Elder, I don't even know what
LJ,
you.
can I say something?
Sure.
I don't think it's an age thing, honestly. The first
Oh
time
no, no.
that a PT person told me, "Let me see how you breathe." When I breathed in, My stomach was going inside. And when
Yeah.
I breathed out, and when I asked everybody in my family, they were almost all doing the same thing. Nobody actually teaches you how to breathe. This is a really good exercise. I mean, you do have to fill up your stomach area with, it has to get bigger like a
Yes.
pregnant. Yeah.
Yep. Yep. I was actually, that's why I mentioned about the, the pelvic, pelvic health patient that I'm seeing right now. 50% of them doesn't know how to breathe properly. So yes, it's not an age thing and has nothing to do. So sometimes breathing comes, I always tell my patients, it's not really anybody's fault because breathing is supposed to be a natural thing, right? It is something like, oh, I know how to breathe. That's like, me living. So, but the way is trying to just nailing the breathing part, will basically improve your core because whenever you see how on number 3, chest and shoulder has to relax. There, you don't need an extra, extra muscle to move. Your belly has to expand after you fill it with air, and then you exhale through your nose or your mouth, and then that's when you actually make that belly smaller, right? So definitely, if you're, and this is something, a picture that you can probably look into, or it's always good to do mirror imaging, meaning look at yourself in the mirror when you breathe. When you breathe, do you lift your shoulders up? Do you even open your chest or lift your chest? If that is happening during inhale, then it means that you are a shallow breather. So you have to keep practicing, touching your belly. Imagine, like, whenever you're inhaling, that it's the belly that is moving more than your chest. I usually ask my patient, put one hand on the chest and put the other hand on your belly, right? So if you breathe and you feel, which I will ask, which hand is moving, is it the one on your chest or is it the one on your belly? So if the answer is, well, it's my belly, I feel it more on my belly, then you are doing your belly breathing. So just try to practice it. Again, practice makes perfect. So the more that you do it, the more. So initially, you probably feel like, well, I think I'm not doing it right. So, like I said, try to look at yourself in the mirror, try to see if there's any accessory movements, movement that is not supposed to be there, right? And then eventually you're going to be able to see, like, oh, now this is actually much more natural, right? So, belly breathing is the first one that you need to activate your core with. All right, so let's go to the next one. So, yeah, apparently I put standing before sitting. All right, standing abs workout. So, if you notice, so these are just common exercises that we actually need to do. And the reason with this is because your core there, it's either you move forward, right? That is a function of, because it's trunk flexion, you're moving your chest towards, your knees or towards your lower legs, or you move your you know your body, your upper body, from side to side, just like on the first picture. And then the other one is rotating, just like the second picture. You see, so the first picture, you're actually activating. So again, it might look like they have weight, right? So again, this is more like a progression. If you feel like, LJ, I can't do the one in the weights, we have another set of exercises that you can do while in a seated position. But when you are standing, you're working, you know, your muscles right here when you're trying to move from side to side, on the first one. The second one, like I said, that's rotation. That's your standing core stabilization. And then you got your row extension. So this one is a little bit challenging, right? The third exercise, because what it means is you have to be able to coordinate, right? Lift one hand and then lift the opposite leg. So if you already have issues with balance, so I feel like, again, try to check if this is something that is right for you. If you feel like I can't even lift my leg up for, for 2 seconds, so therefore exercises that requires for you to to lift that leg with weight or without weights, without holding on to anything, try to manage your exercises based on your level. So that is your standing ab workout. So, initially, if you can't do both hands free, you can always hold on to the counter and do the exercise, right? And then of course we have the dumbbell chop, where you're, instead of just doing one plane, you're moving from right up and then you're going all the way down as if you're chopping wood. So that's the fourth exercise. All right. And then we have seated exercises. So I'm going to send you the link of all the seated core exercises that we usually give to our patients. So we have bilateral. So the first one is your crunch kicks, side to side knee sweeps, and then your knee to elbow. So the bottom line of these exercises is, if standing exercise is actually challenging for you, then definitely seated will be good. And again, if you notice, like LJ, I cannot lift both my legs, you can always do alternating. You can just keep one leg down and just lift, the right leg first for 10 repetitions and then change and do the left side, right? So like I said, if you want, if all this exercises is something that you feel, I know I can do them, but I'm kind of scared or what, you can always call me, hop on, a FaceTime, or we can do a video call or anything like that. If you have any specific exercises that you would want me to check or you would want me to see, or you can send it to my email, right? So if you have any recommendations or you feel like this is the exercise I actually use and it really worked. So again, knowing what the function of your core is, right? It's always important to kind of learn that. And the great thing about that is, the more that you improve your core, you actually improve your overall pelvic health, right? Matt, you can help manage your incontinence. But again, that's a different topic altogether. It also help you with your balance. It also help with your posture and overall you know well-being. So seated core is always a good way to start if you can't do standing. And then finally, everyday acts, functional core. I already talked to you guys about hip hinging and spine sparing from the previous workshop. So I feel like functional, if you go through, practice makes permanent, right? Everyday act, bending to put your shoes on. So it doesn't have to be a specific exercise. I always try to tell my patient, one of the things is, I never exercised my whole entire life, and then now I'm in pain or now I have balance issues. You want me to go to the gym? So there's, a lot of things like that. And like I said, you know what? What do you like to do every day? I have one patient says, well, I go up and down the steps. That's what I actually like to do. Right? Go up and down the steps. I said, what else? Well, I help, I help do the laundry. Oh, perfect. What about the dishwasher? Yeah, every once in a while I do help with a dishwasher. What about your folding clothes? So you see how it doesn't have to be a specific regimen. The more you actually incorporate, this is more work life integration. You're integrating what you need to get done, right? Instead of separating it with, the things that you do already, try to integrate it in your everyday activity, right? Because a healthy core actually prevents you from having any low back pain, that can be debilitating sometimes. So anything that, can help you kind of coordinate and calibrate your life to improve your core, the better. And then these are the resources. These are all links. I'm going to send you the presentation so you can have an idea what it looks like. So here, this is where most of my presentation came from. You're not going to see it, but this is this whole entire thing, right? And then that's the first resource. And then there's one, what you can do to prevent falls. It's an infographic. So there's also the one that we opened a while ago, right? The National Council of Aging Falls Free Checkup. There's also one for family caregiver, right? So we already talked about last weekend we talked about caregiving, right? So this is something that you can actually take, and it's from the CDC, right? So it is basically family caregivers. How do you protect your loved ones from falling? And again, see, it's from the Center of Disease and Control and Prevention. So they have a program called STEADY, Stopping Elderly Accidents and Deaths in Children. So that's a very, very important program. I would want you guys to be involved with. Okay. So there is another one, and this is very important as well, especially if you're like, it's my home. So you're not changing yourself, right? So you're, this because it does take time, right, for you to get stronger, but you want to make changes in your surrounding. Guess what? The CDC created a checklist.
Huh?
Wait,
There is a
LJ,
checklist.
there's a lot of background noise.
I
Oh,
don't
I'm not
know.
sure. Maybe you want
Nobody
everybody to
knows a
mute.
lot.
yeah. Can you wait, let me see if I could. All right. There. All good? All right. So this is just a two-page. So you don't have to go through, researching. This is a one-stop shop. So I hope your guys are check for safety. So this is, as a clinician, this is what I use all the time because it is the recommended checklist from CDC. So it will check your steps. So let's just say always keep objects of the stairs. So is it a check? Are there paper, shoes, books, or other objects in your stairs? So if it's a check, then it means you're good, right? There's also one for the floor. There's also ones for the bedroom. So if your therapist, if you're doing home visit or anything, and they ask you, can you remove the rug, on your floor? So there is a reason why it's that. Okay. So these are the fall prevention checklist for you guys. So it's again publicly available from CDC. So just make sure it actually covers everything, right? The stairs, the floors, the kitchen, right? Bedroom, bathrooms. That's it. It's just one page. Okay. And then I think those are all the important resources that I would want you to check out after this presentation is over. And then finally, thank you. All right. So 7:44 time check. Again, I apologize for going over, but if you have any questions or any concerns, please feel free to, can ask it now. But before we do that, for those who wants to, log out, you have basically wanted to do something else. So this is the end of the presentation. However, before you guys go, I wanted to let you guys know again, every every last Monday of the month, we always going to have a date. Every month will be a different topic, but this topic is something that's really close to my heart, and that is the puzzle pieces of managing. I don't know why it went like that, but the puzzle pieces of managing lymphedema. So that's going to be on November 25 at 7 p.m. So the just a precursor for lymphedema. Lymphedema is one of those most overlooked condition. And if you want to learn, so this is like the basic about your lymphatic system, right? That's the first puzzle piece, learning what's supposed to be considered normal. So we're going to talk about lymphatic system. We're going to discuss what can you do right now to improve your lymphatic. It will actually include managing what you're eating, how you're actually doing your exercises, how you can do your manual lymphatic drainage, right? So anyway, that's going to be on November. So if you guys are available, I'm gonna, just like how I'm doing it, I'm gonna send you the link. I'll probably send you a presentation ahead of time, and at least you guys have an idea what we're gonna talk about. And yeah, and then right now we're going back to Q&A. and let me be doing your exercises, how you can do your manual lymphatic drainage, right? So anyway, that's going to be